We can start class. Okay, we can start the class. So today we can start with ulna. So ulna, it is very important bone, and it is a bone used for bone grafting. And first we can talk about the ossification of ulna. So again, this bone has one primary center and two secondary center. So on my primary center is for the shaft and most of the upper end, okay? And it appears in the 8th week of intrauterine life. As usual, most of the bone, all the bone except clavicle, the primary center appears in the 8th week of intrauterine growth. And next two secondary centers, one for superior part of olecranon process and one for lower end. So for superior part of olecranon process, it appears in 10th year, and for lower end, it appears in the 5th year. So the superior part of olecranon process fuses in 16th year, and lower end, it fuses in 18th year. So now we can talk about the features, the external features of ulna. Okay. So along with that, we can discuss about the muscle attached in those external features. So both are given parallelly here. So first, so this is a long bone, so it has two ends and a shaft. So first we can talk about the shaft. So for easy way of studying, we are dividing the features of shaft into borders and surfaces. So how many borders are there? There are three borders. And how many surfaces are there? Three surfaces. So what are the borders? So it has lateral border, anterior border, and posterior border. So one point you should keep in your mind that radius bone, it has a radius bone, it is a lateral side bone. So it has a lateral surface, and it has a medial border. So just opposite side will be the border. Okay. So radius bone, lateral surface, medial border. Now we are coming for the medial side bone, that is ulna. So ulna is a medial side bone. So it has a medial surface, and the border will be lateral border. Opposite side, that is the lateral border. The surface is medial and border is lateral. Okay. So now we are coming for the borders again. So what are the borders in ulna? Lateral border and anterior border, posterior border. So this lateral border, it is shorter and it is otherwise called as interosseous border because it gives attachment for an interosseous membrane. So next we are coming for surfaces. How many surfaces are there? Again, three surfaces. What are the surface? Anterior surface, posterior surface, and medial surface, because this is the medial bone. Okay. So for our easy way of study, we are dividing the surfaces into parts. Okay. Anterior surface, we are going to divide into upper 3/4 and lower 1/4. In this lower 1/4, we can see one ridge called as oblique ridge. So why we are talking about all these parts means, so the muscles are attached separately in upper part and lower part. So for our easy way of study, so we are dividing into upper 3/4 and lower 1/4. And lower 1/4, we have a ridge called as oblique ridge. So next we are coming for second surface, that is medial surface. Medial surface, so upper 3/4, it gives attachment for a muscle. Okay. And the lower 1/4. So we are dividing into two parts, upper 3/4 and lower 1/4. Okay. Next one is posterior surface. So posterior surface, very, very important in this ulna. Okay. So in this posterior surface is seem to be complicated arrangement. Okay. So how it is complicated means, so it is not the even area, it is not a plain area. Instead, so in the it is divided by an oblique line. Posterior surface, you can see oblique line. This oblique line divide the posterior surface into upper part and lower part. Okay. So above the oblique line, it is called as upper part, and below the oblique line, it is called as a lower part. Now, the lower part is again divided. The posterior surface, lower part, it is again divided by a vertical line into medial area and lateral area. Okay. So posterior surface, now it is divided into three parts. What are the three parts? First one is above oblique line, it is called as upper part. And now below oblique line is again divided by a vertical line into medial area and lateral area. So when you think of posterior surface of ulna, you should think of three areas. So now we are coming for lower end. So lower end of ulna, it is very simple. Here we can see head of ulna and styloid process. Okay, so it is just inverse when compared to the radius. Radius we saw a disc shaped head above or in the upper end. Here in ulna, you can see the head and the lower end. So next one is styloid process. So what is styloid process? Where it is located? So already we know styloid process. It is an elongated process. It is present in ulna. It is present in posteromedial side. Okay. So this point is very important during side determination. Posteromedial side. We medial to the lower end of ulna. Okay. So now we are coming for muscles attached in these features. Okay. So first we are coming for borders. So what are the muscles attached in the border? So we can see we are coming to the posterior border. Okay. So posterior border gives attachment for three muscles. Very, very important. What are the three muscles? So first muscle is flexor digitorum profundus. Okay. So there is this, we all know flexor digitorum profundus. So this profundus muscle is a bulky muscle. It is a larger muscle. Okay. So this muscle will get its origin from major parts in ulna. Okay. Not only posterior border, it also gets its attachment from other parts of ulna. Okay. So first muscle which is attached in posterior border is flexor digitorum profundus. And what are the remaining muscles? Other two muscles are ulnaris muscle, flexor carpi ulnaris and extensor carpi ulnaris. Both the carpi ulnaris muscle, that is flexor carpi ulnaris and also extensor carpi ulnaris, both will get origination from the posterior border. So automatically overall, posterior border gives origin for three muscle, flexor digitorum profundus, flexor carpi ulnaris, extensor carpi ulnaris. Okay, so now we are coming for the surfaces attachment. So anterior surface we saw it is divided into upper 3/4 and lower 1/4. So upper 3/4 it again gives origin for a muscle called as flexor digitorum profundus. So already we saw flexor digitorum profundus is a vast muscle or broad muscle. So it should get origin from the major areas or more number of areas. Okay. Anterior surface upper 3/4 it gets origin. It gives origin for flexor digitorum profundus. Now coming to the lower 1/4. Lower 1/4 has an oblique ridge. Okay. So this ridge give origin for a muscle called as pronator quadratus. So already we have seen radius also, anterior surface, lower part, it gave insertion for pronator quadratus. So pronator quadratus, as the name says, is quadrangular muscle. This is a quadrangular shaped muscle. Okay, so it gets originated from the ulna and inserted in the radius. Okay, so oblique gives origin for pronator quadratus. So anterior surface, we can see two muscles. Now coming to the medial surface. Medial surface is again divided into upper 3/4 and lower 1/4. So upper 3/4 gives attachment for one muscle. Okay. So lower 1/4 there is no muscle. So we are not talking about lower 1/4 here. So only upper 3/4 of medial surface it gives origin for a muscle. Again the same broad muscle flexor digitorum profundus. Okay. So flexor digitorum profundus, it gets origin from two surfaces and one border. What are the two surfaces? Anterior surface, medial surface, and the border is posterior border. So now coming to the next structure, that is posterior surface. What are the muscles getting originated in the posterior surface? Okay. So so already we have divided posterior surface into three parts. One is upper part, and next one is the medial area and lateral area of the lower part, isn't it? So now we are coming for the structure attached in the upper part. So upper part of posterior surface it gives insertion for extensor muscle that is called as anconeus. Okay, so anconeus is inserted in the upper part of the posterior surface. So next we are coming for the lower part. So lower part we have two area, medial area and lateral area. Now we are leaving medial area. The lateral area it gives it gives origin for three muscles. Okay. So please remember here lateral area it is giving origin for three muscles. What are the muscles? Abductor pollicis longus above, and next one is extensor pollicis longus, and last third muscle is extensor indicis. Okay, so how to remember whether it is medial area or lateral area? So one thing you should remember, extensor muscle and abductor muscle always comes in lateral area. So it should come posterior side or lateral side. Okay, so here this lateral area, so this posterior surface we are remembering the lateral area. Okay, so please ignore the medial area. So you should remember lateral area it gives origin for abductor pollicis longus, extensor pollicis longus, extensor indicis. So these muscle will be originated. Okay, now coming to the lower end there is no muscle attached. Okay, so now we are coming for the diagram. We can see the ulnar bone, you can see the radial notch, and we can see the trochlear notch, and you can see the border here. Okay, so posterior aspect we can see the oblique ridge above, and below you can see the vertical part. Okay, vertical line, so which divides into medial and lateral area. So in this picture, we can see both the radius and ulna together. So when you see the ulnar bone, you can see in the middle the vast muscle that is flexor digitorum profundus. Okay, so it covers both the anterior surface and medial surface. And below you can see lower 1/4. You can see the pronata quadrata muscle. It gets arginated, and parallelly in the radius bone, we can see lower part the pronata quadratus is inserted. Okay, so these are the muscle attached in this region. Okay. Can you see here in this picture the ulnar bone posteriorly? We can see the what is that lateral aspect. We can see three muscles arising above abductor pollicis longus. Next one is extensor pollicis longus, and the third one is extensor indicis. So now we can come for externals of what is that ligaments attached. Okay. So first one is uh, oblique cord. So oblique cord it is attached in the coronoid process. Okay. And next one is the capsular ligament of elbow joint. It is attached in the trochlea, around the trochlea. And next one is annular ligament. It is attached in the head of the radius. Okay, so oblique cord, capsular ligament of elbow joint, and annular ligament. And next here again interosseous membrane is attached in the interosseous border. And next you can see here that is ulnar collateral ligament which is attached in the styloid process. So it also gives attachment for another one structure that is articular disc. Ulnar collateral ligament and articular disc. So that's all about the ligaments attached. So next we are coming for clinical anatomy. So clinical anatomy of this ulna. So the ulna is again prone for fracture. Okay, so most of the important site of fracture is olecranon process. Okay, and this ulna is again a very important bone for bone grafting. So second one is Madelung deformity. So what is Madelung deformity? So this Madelung deformity it occurs, it happens because of the retarded growth of radius. If there is a retarded growth of radius, the ulnar bone automatically it goes for subluxation. So dorsal subluxation of ulna due to retarded growth of radius. Okay. So this is about the Madelung deformity. You can see the picture here. So in this picture, you can see the ulnar side or medial side. You can see the protrusion or subluxation of the ulna. So next you can go for the carpal bones. Okay. So we have completed all the long bones. So now we are coming for the short bone in the upper limb that is called as carpal bone. So you can see in this picture, the carpal bones are arranged in two rows, proximal row and the distal row, proximal and distal. Okay. So we can come from lateral to medial side. The first bone proximally, it is a scaphoid bone. Second one is lunate. Third one is tracutral, and the last one is pisiform. Okay. And when you come to the distal row, trapezium, trapezoid, capitate, and hamate. Okay. So this is how the carpal bones are arranged in two rows. All comes under category short bones. So out of all these carpal bone, the capitate bone, it is the largest one, and pisiform is the smallest one. And you can see the arrangement clearly here. So now again we are coming for ossification. So what are the muscle, what are the here, how the bones are ossified. So there is a speciality in this carpal bone, that is, so the bone or cartilage is at birth, okay, and it ossifies in spiral direction, okay. So it starts its ossification in spirally, okay. So already we know there are 8 bones arranged in 2 rows, isn't it? So it starts from capitate. The first bone to ossify in the carpal is capitate bone. Okay, so the first bone is capitate, second bone is hamate, then tracutral, lunate, scaphoid, trapezium, trapezoid, and the last bone to ossify is pisiform. So this is how the carpal bones are ossified. Okay, so direction of ossification is spiral direction. Okay, so now we can talk about the year. The capitate bone ossify in first year, hamate, first year, tracutral, 2 to 3 years. It may vary. Okay, so there is a variation. So here we are talking about the range. Tracutral, it will ossify from 2 to 3 years, lunate 3 to 5 years, scaphoid 6th year, trapezium 6th year, trapezoid 6th year, pisiform bone 10 to 12 years. So now we are coming for the external features of scaphoid. So we are going to talk about very important external features. So this how to identify and how to site determination. Site determine this all these carpal bones. Okay. So the most important shape. So first we can discuss about the shape of the bone. Scaphoid bone. So scaphoid bone, the shape is boat shape. Okay, and the scaphoid means boat. And what is the main feature of the scaphoid bone? It has a tubercle in lateral side. So scaphoid bone has a tubercle in lateral side. So next one is lunate. So lunate, luna means moon, isn't it? So here the lunate is, it seems to be half moon shape. Tracutral, so it is pyramidal in shape. So the name says it has 3 sides. So pyramidal in shape, and this tracutral has a oval facet in the palmar surface. Okay, so for the articulation of P, that is pisiform bone. Okay, so it has an oval facet in palmar surface. Next one is pisiform. So pisiform is the smallest bone, and it is a sesamoid bone. So this smallest, it would be called as the smallest sesamoid bone in our body. Okay, and this pisiform bone, it is P-shaped, and it has again a facet on the dorsal surface. So next one is trapezium. We are coming for distal row. Trapezium, quadrangular in shape. Okay, so it has a crest and groove anteriorly. This bone has a crest and groove anteriorly. And next one is the trapezoid. Trapezoid. Okay, so trapezoid means the shape is seems to be the shoe of the baby. Okay, and next one is capitate. So capitate, it has a rounded head and it is a large carpal bone. And next we are coming for hamate. Hamate, it is a wedge-shaped bone and it has a hook near the base. Okay, so hamate has a hook in it. So next we are coming for the muscles and other structures attached in this carpal bone. So first we are coming for a scaphoid bone. So scaphoid bone has a tubercle, and this tubercle gives attachment for muscle and other structure. So you should imagine when you see the carpal region or when you see the wrist region, we can see the arrangement of 2 rows of carpal bone, and these structures are connected. Either side it is connected by a retinaculum anteriorly called as flexa retinaculum. Okay, so this flexa retinaculum is attached in the either side of the carpal bones. Okay, so it is attached in the either side of the carpal bones, and so it makes a tunnel shaped structure called as carpal tunnel. Okay, so carpal tunnel is made by the attachment of the flexor retinaculum over the scaphoid, sorry, over the carpal bones. Okay. So automatically the retinaculum, flexor retinaculum, it should attach in the carpal bones. Okay. So first attachment is tubercle of scaphoid. So tubercle of scaphoid gives attachment for flexor retinaculum, and then it also gives origin for a muscle. So here again I have indicated the origin muscle in red color and insertion muscle in blue color. It gives origin for a muscle called as abductor pollicis brevis. Next, pisiform bone. So pisiform bone, it gives again it gives attachment for flexor retinaculum. Okay, so lateral side bone scaphoid also it gives attachment for flexor retinaculum, and medial most bone pisiform also gives attachment for flexor retinaculum. And this pisiform also gives attachment for extensor retinaculum. Dorsal side it gives attachment for extensor retinaculum. And then, so this pisiform gives insertion for a muscle called as flexor carpi ulnaris, and abductor digiti minimi muscle is originated. Okay, abductor digiti muscle, which digiti minimi muscle, which is a hypothena muscle. It is originated from the pisiform muscle, pisiform bone. Okay. Now we are coming for trapezium. So trapezium we saw it has a crest, isn't it? So this crest, so this is the lateral side bone in the distal row. So this trapezium gives attachment for flexor retinaculum, and also it gives attachment for a ligament called as lateral ligament of wrist joint. Okay. Next, so this crest also gives origin for three muscles. So those three muscles are called as thenar muscles. What are those muscles? Abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. So here you should see of the ending name, the ending term, that is brevis. Okay, you should not use the word longus. It is the brevis. Thenar muscles all are short muscles. So abductor pollicis brevis, flexor pollicis brevis, and again opponens pollicis. So next we are coming for trapezium groove. So we saw trapezium has two structures. One is crest, one is groove. So groove, what is for this groove? So it lodges tendon of flexor carpi radialis. Okay. So next one is hamate bone. So hamate bone, so it gives, we saw it is a medial side bone. So it gives attachment for again flexor retinaculum, and it gives origin for two muscle flexor digiti minimi and opponens digiti minimi. Both are hypothenar muscle, flexor digiti minimi and opponens digiti minimi. So now we are coming for clinical anatomy. So the clinical anatomy about carpal bone. So that is very important one is. So we can talk about two important carpal bones, that is scaphoid and lunate. So scaphoid has more clinical importance here. Okay. So fracture of scaphoid is more common, and most of the time the fracture happens in the waist of the bone. Okay. And during this fracture, the person will feel pain in the anatomical snuff box. Okay, and the most of the time, so this fracture will lead for avascular necrosis. So why we can see this avascular necrosis in this bone is, so this bone receives two nutrient artery. Okay, so both the two nutrient artery will be passing through the distal part of the bone. So if there is a fracture in the waist region, the proximal part of the bone is devoid of blood supply, and this part will prone for necrosis. Okay, so we can see avascular necrosis in the proximal part of scaphoid bone if there is any fracture in the waist. Okay, waist region of the scaphoid. Next, you are coming for Second thing, that is lunate bone. There is a dislocation of lunate. Also, this is also common in carpal bones. And you can see in this picture, so this is a carpal bone picture, and you can see the scaphoid bone fracture. There are three types of fracture. So you can see distal fracture, waist fracture, proximal fracture. So distal and proximal fracture. So in this condition, there is no, what is it, avascular necrosis. But in the waist fracture, in this fracture is prone for avascular necrosis because the proximal area will be devoid of, this will prone for devoid of blood supply, and this will lead to avascular necrosis. So now we are coming for metacarpal bones. So we have 5 metacarpal bones. So when you see the metacarpal bones, so this will be called as miniature long bone. Okay, so this comes under miniature long bone, and you can see the base, and it has a shaft and it has a head. Okay, so as it is a long bone, there will be presence of shaft in this bone. Okay, so next, so we can talk about the ossification of this metacarpal bone. So there are 5 metacarpal bone. So all shaft ossifies from one primary center each. Okay, all shaft ossifies from one primary center each, and ossification points will be appearing in the 9th week of intrauterine life. So now we are coming for secondary center. So again, all the 5 bones have one secondary center. So the second to 5th metacarpal bone ossification secondary center will form in the head, and for first, the secondary center will form in the base. Okay. So for all the metacarpal bone, the secondary center will form around 2nd to 3rd year, and it fuses in 16th to 18th year. Okay, so this is about the secondary center ossification. So now we are going for again the features of the 5 metacarpal bone and what are the structures attached in the 5 metacarpal bone. So first we are going for the first metacarpal bone. So to seems to be, we can see the first metacarpal bone is shortest bone and it is a stoutest bone, and this bone, the direction is, it is rotated medially through 90-degree. Okay, so that only we can rotate the thumb in all direction. The arrangement, the presentation is, it is rotated medially through 90-degree. Next, we are coming for second metacarpal bone. So here the base is grooved, okay, and the medial edge is larger. The medial edge of base is larger. Next, we are coming for third metacarpal bone. So base has a styloid process. So very easy to identify the third metacarpal bone. It has a styloid process and it is present dorsolaterally. So next one is fourth metacarpal bone. The base has 2 oval faces for third metacarpal bone. Okay, so base has 2 oval faces for the articulation of third metacarpal bone, and it has single elongated facet for fifth metacarpal bone. Okay, so fourth one, it articulates in the either side, it articulates. Okay, that side, that is it articulates the third metacarpal bone, and this side it articulates with the fifth metacarpal bone. Next one, what about the fifth metacarpal bone? So this fifth metacarpal bone has a tubercle in its medial side. Okay, it has a tubercle in its medial side and laterally elongated articular strip for fourth metacarpal bone. Okay, so it has an articular area or strip for fourth metacarpal bone. So now we are coming for muscles attached. So what are the structures attached in this feature? So first we are coming for first metacarpal bone. So first metacarpal bone gives insertion. So insertion for a muscle opponent's pollicis, okay, which is a thenar muscle. Okay, second one is it gives insertion for abductor pollicis longus muscle, and it also gives origin for interosseous muscle. So you should keep in your mind all the interosseous muscle will be originated from the metacarpal bones. So, okay, blindly we can say metacarpal bones. So all the metacarpal bones will be giving origin for the interosseous muscle. So the third metacarpal, except third metacarpal bone. So a third metacarpal bone, it won't give origin or it won't give attachment for the palmar interosseous. So all other what is it, metacarpal bone give origin for both palmar and dorsal interosseous except third. Third metacarpal bone, it gives origin for only dorsal interosseous. No palmar interosseous is attached in the third metacarpal bone. Remaining all other muscle is attached in all the metacarpal bone. Okay. So again, we are coming for our topic. So once again, I repeat. So first metacarpal bone, it gives insertion for opponent's pollicis, abductor pollicis longus, and again we can say first palmar and dorsal interosseous is attached. Okay, both interosseous muscle always it originates here. Okay. So next we are coming for second metacarpal bone. So it gives insertion for flexor carpi radialis and next one is the extensor carpi radialis. Both the carpi radialis muscle is inserted in the second metacarpal bone. And next one we can see adductor pollicis oblique head. It is originated and again it also gives origin for second palmar interosseous muscle. Okay. So we can see the two muscle is inserted here and the remaining muscle is originated here. Third one is base. So already we saw it has a styloid process dorsolateral, isn't it? So now in that medial aspect, we can see the muscle attached. What are the muscles attached? So first one is flexor carpi radialis. It is inserted here, and then extensor carpi radialis longus. It is again inserted here. And next one is adductor pollicis oblique head and the transverse head. Both are originated in the third metacarpal bone. So you should keep in your mind third metacarpal bone. It gives origin for the adductor pollicis muscle. So adductor pollicis muscle already we know we have two heads. One is transversely present transverse head and other one is obliquely present oblique head. Okay. And next one is fourth metacarpal bone. So fourth metacarpal bone, no other muscle except dorsal interosseous. Okay. So sorry, the interosseous muscle. So both dorsal and palmar interosseous muscles are attached or originated in the metacarpal bone. So except interosseous muscle, no other muscle is originated or inserted in the fourth metacarpal bone. Okay. The fourth metacarpal bone has only the interosseous muscles in it. Next one is fifth metacarpal bone. So fifth metacarpal bone, we can see extensor carpi ulnaris is inserted. Extensor carpi ulnaris, it is inserted. And next one is opponent's digiti minimi, it is again inserted. So two muscles are inserted in the fifth metacarpal bone. Okay. So next we are coming for just interosseous muscles. Already I said there are four palmar interosseous and four dorsal interosseous. So for dorsal interosseous it is very easy. All the four muscles are attached in the adjacent side of the metacarpal bone. So all the metacarpal bone gives origin for dorsal interosseous muscle. What about palmar interosseous muscle? So again, there is four palmar interosseous muscle. Again, we can say all the what is it? All the four uh, metacarpal bone gives origin except one bone, that is third metacarpal bone. So third metacarpal bone is devoid of palmar interosseous muscle. Okay. So first, second, fourth, fifth, it gives attachment for palmar interosseous. Okay. So you can remember this point. Palmar interosseous, it is not attached in the third metacarpal bone. Okay. So now you can see in this picture the palmar interosseous muscle. So here you can see in the middle finger, that is third metacarpal bone, there is no palmar interosseous. So the thumb in this picture, the thumb first metacarpal bone, The palmar interosseous diagram is not here, but it is present. Okay, so we have four palmar interosseous, and middle metacarpal bone has no attachment for palmar interosseous, except those metacarpal bone. Other metacarpal bone will give origin for palmar interosseous. So next we are coming for dorsal interosseous. So dorsal interosseous, it gets attachment in all the metacarpal bone. Okay, so both either side of adjacent side bone will give origin for dorsal interosseous. So now we are coming for clinical anatomy of metacarpal bone. So metacarpal bone, the fracture, you can see Bennett fracture. What is Bennett fracture? It is an important question. So the fracture of base of first metacarpal bone. Okay. So the first metacarpal bone base, if it is fractured, the condition is called as Bennett fracture. So what is the clinical significance here? What is the patient will be coming with the uh, pain in making fist, or patient cannot make the fist. Okay, so that is a typical sign for Bennett fracture. So now we are coming for the last bone, that is the phalanges. Okay, so we have proximal phalanges, middle phalanges, and distal phalanges. So the first one is ossification. We can talk about ossification. So we can go for three separate ossification. So primary center. So distal phalanges, we can see the primary center will appear in 8th week, and proximal phalanges, the primary center will appear in the 10th week, and middle phalanges, the primary center will appear in the 11th week. Okay. Next one is secondary center. For all the bases of all phalanges, the secondary center will appear in the second year. Okay. So next one, it fuses in the 16th to 18th year. Okay. So primary centers, or separately it appears for each phalanges, but for secondary center, we can see for all the bases we have a separate secondary center. Okay. So next we are coming for the external features of the phalanges with its attachment. Okay. So totally we have 14 phalanges. We have 14 phalanges. So distal phalanges of medial forefinger. So distal phalanges of medial forefinger, it has a base, and the palmar surface of this base, it gives insertion. So phalanges bone, it gives insertion. No origin is there. All the muscle which is attached, it is inserted. The palmar surface, it gives insertion for flexor digitorum profundus. Okay, flexor digitorum profundus, it is inserted in the palmar surface of the base of medial forefinger of distal phalanges. Okay, now we are coming for next one, dorsal surface. Dorsal surface, it gives attachment for dorsal digital expansion. Dorsal digital expansion. So distal phalanges, so palmar side you can see the flexor digitorum profundus. Dorsal side we can see dorsal digital expansion. So now we are coming for the distal phalanx of the thumb. So already we saw for medial forefingers. Now the remaining thumb we are saying the base of thumb palmar aspect, it gives insertion for a muscle flexor pollicis longus. All other finger, remaining finger, flexor digitorum profundus. But for the thumb palmar surface, you can see flexor pollicis longus. And what about dorsal side? Dorsally, we can see extensor pollicis longus. So both the pollicis longus flexor and extensor pollicis longus, which is inserted in the base of the distal phalanges of thumb. Okay, so this both are inserted. Okay, keep this in your mind. Now we are coming from middle phalanx. Okay, so middle phalanx coming to the base. So two sides of the shaft. Okay, so when you come from middle phalanx, so when you are coming from middle phalanx, the muscle is attached in the either side of the shaft. Okay, right side and left side of the shaft. That is flexor digitorum superficialis muscle. Okay, so flexor digitorum superficialis is inserted in the middle phalanx. Flexor digitorum profundus, it is inserted in the distal phalanx. And now again, dorsal surface, it gives insertion for the extensor distal expansion. So the distal extensor distal expansion, it is attached in the dorsal surface of middle phalanx. So now we are coming for what are the muscles attached in the proximal phalanx. Okay, so proximal phalanx, we can see multiple muscles are attached. So we are going to see under the tabular column. Okay, so each finger we can see either side, radial side and ulnar side, we can see the muscle attachment. Okay, so first we are going to see the thumb proximal phalanx. So in the thumb, the proximal phalanx, the muscle is attached in the three sides. Okay, radial side, ulnar side and dorsal side. Okay, so what are the muscles attached? In the radial side, you can see abductor pollicis brevis, flexor pollicis brevis. Okay, so all the muscle we are seeing here are inserted. Okay, radial side abductor pollicis brevis, flexor pollicis brevis. Ulnar side adductor pollicis and first palmar interosseous muscle. Okay, so what about dorsal side? So dorsal side, the extensor pollicis brevis is inserted. Okay, so only for thumb we can see three side insertion: radial side, ulnar side, and dorsal side. And next we are coming for index finger. Index finger proximal phalanx. The two side the muscle is inserted. Radial side we can see first dorsal interosseous muscle is inserted. Ulnar side second palmar interosseous is inserted. Now we are coming for middle proximal phalanx. Here again either side we can see muscle is inserted, radial side and ulnar side. So radial side second dorsal interosseous, ulnar side third dorsal interosseous. Okay, and ring next we are coming for ring finger, sorry, middle finger. So middle finger again we have either side radial and ulnar side. So radial side second dorsal interosseous, ulnar side third dorsal interosseous muscle is attached. And next ring finger radial side ulnar side, radially third palmar interosseous is attached, ulnar side fourth dorsal interosseous is attached. Okay, little finger again radial and ulnar side. So radial side fourth palmar interosseous is attached and the ulnar side abductor disti minimi, flexor disti minimi is inserted. So when you see in this tabular column, the thumb finger and little finger, we can see both interosseous muscle and the other muscles are attached. But for index, middle and ring finger, only the interosseous muscle is attached. Okay, so keep note of this. Okay? So this is about the proximal phalanx muscle attachment. So that we are completing the phalanx features and the muscle attachment. So that we are completing our osteology class of upper limb. Okay, so upper limb we have seen the what is that? The first we talked about the what is that ossification. Then we talked about the external features, the muscle attached and the ligaments attached. So parallelly, I have shown you the tabular column. So when you compare and study, it will be easy for you to understand. So left side we can see the features and right side we can see the muscle attached. So when you study comparing either thing, it will be easy to understand. And the ligaments also the same external features and the ligaments attached. And if you study in this tabular column, it will be easy for you for your further revision. Okay. So thank you so much.